the broader experiences of self-criticism, loneliness, imposter syndrome, as well as pain. So these struggles can affect how we relate with others, how we perform in our personal and professional lives, and how we perceive ourselves. So the theme is significant as it lies in bringing those inner struggles to light. Often the stigma surrounding mental health can make people feel isolated, ashamed, or reluctant to seek help. But by addressing these topics openly, we can begin to dismantle this stigma and create a culture of empathy and understanding. The goal of this webinar is to encourage people to reflect on their inner worlds, acknowledge your struggles, and equip them with the tools to navigate and heal those challenges. This theme is supposed to remind us of these internal battles and let us understand that these struggles do not define our self-worth or our capabilities. Through sharing and supporting one another, we can gain resilience and foster personal growth and find strength in vulnerability. So I just want to categorically state that we are here to learn. We are here to tap from the wealth of knowledge of our speaker. And by the end of this program, we believe that every attendee here would be happy that he attended. Thank you very much. Over to you, Adebayo.
Thank you very much. Coming on to Igbola, thanks for taking us through the theme and the significance of this webinar. On to the next one. I would like to pass the mic to Saliu Aibami. I think you'll be taking an introduction of our guest speaker.
Thank you so much. Today I'll be taking a introduction of guest speaker. Firstly, I'd like to introduce him to many of you. So, Psych Aid Network Initiative is a mental health charity organization with a team of mental and physical professionals dedicated to promoting mental and community health. We provide services that are aimed at special education in various mental health disorders, assessment of mental health needs, promoting mental health needs, and individuals with mental health specialists, sponsor mental health care, treatment of programs for life failure, facilitate access to mental health services, resources, and early conducting public health lectures aimed at preventing the development of drug addiction, mental health programs, public health programs, promoting emotional health.
Sorry, I hope my audio is better now. Please.
Yes, much better. Thank you.
Sorry, I didn't get that. Is the audio better now?
Yes, it's much better. You can proceed.
All right, thank you. I'll take it all over again from the start in case people didn't get me at first. All right, so I'm introducing PANI, right? So PANI, Psych Aid Network Initiative, is a mental health charity organization with a theme of mental and public health professionals dedicated to promoting mental and community health. Their services include psychoeducation on various mental health disorders, assessments of mental health needs, promoting mental health awareness, link individuals to appropriate mental health specialists, promote mental health care treatment programs for less privileged, facilitate access to mental health services, resources, and early intervention, conducting public health workshops aimed at preventing the development of drug addiction, mental health problems, public health programs, promoting emotional and mental well-being. And today we have our guest with us today. That is Dr. Uwaila Olotu. And just a bit about Dr. Uwaila Olotu. Dr. Uwaila Olotu is the co-founder of the Psych Aid Network Initiative, PANI, which is, as I've said before, is a mental health charity organization based in Nigeria. She is a qualified and experienced consultant psychiatrist who completed her postgraduate training in psychiatry in the United Kingdom. She holds the qualifications of Bachelor's of Medicine and Bachelor's of Surgery. She is a member of the Royal College of Psychiatrists, UK, and has a certificate of completion of specialist training in general psychiatry. She was awarded a postgraduate master's degree in mental health studies and mental health law from the University of Nottingham and Northumbria, respectively. Dr. Olotu has special experiences in diagnosis and treatment of mental disorders spanning over a decade. In general adult psychiatry, forensic psychiatry, child and adolescents, and learning disability. She utilizes a well-rounded approach to treatment through medications, active listening, and recommending psychosocial and psychological interventions. So, Dr. Uwaila Olotu, through the Psych Aid Network Initiative, is deeply committed to breaking down the barriers that prevent people, especially the younger generation, from accessing mental health care. She understands the unique challenges young people face, whether it's stigma, lack of access, lack of awareness, or limited resources, and strives to make mental health support more accessible. Pani and Dr. Uwaila Olotu is focused on early intervention psychoeducation and connecting young individuals to the right care by offering resources that promote emotional well-being and promote onset of serious mental health and prevent the onset of serious mental health, Dr. Olotu aims to empower the youth to prioritize the mental health and seek help without the fear of judgment. Through this initiative, she has dedicated to fostering a future where young people have the tools and support they need to thrive mentally and emotionally. Our mission is not just about treatment, but about creating a lasting impact on community health by ensuring that the next generation understand the importance of mental well-being and has access to the help they need. Thank you so much, everyone. And I will pass the mic over to our host for today. And please welcome our host for today, Dr. Uwaila Olotu. Thank you so much.
Yeah. Can you see me? Can you hear me and see me okay?
Yes, Ma, I can see you and hear you clearly.
Okay, that's good. Okay, I think thank you all for joining us today as we dive into this very interesting topic, the struggle within. And hopefully we'll be able to gain useful insights that will help us as individuals and also people around us. Can we share my slides, please?
Ma, please give us a minute. Try to get it up.
Okay. Can you see my screen? Can you see my screen?
Yes, ma'am, I can see your screen.
Okay. Okay. So the struggle within is an experience that resonates with many people. And it's not usually seen. It's very difficult to understand and often very difficult to talk about as well. And that's why we are here today, to learn more about it and see how we can talk about this difficult topic. In life, the battle that we face is not just the external ones, but the internal battles that often sit, silently in the corners of our mind, that shape us and also how we view the world. Those negative thought patterns that creep in quietly in form of feelings, emotions, experiences that just sort of linger on in our minds to create a repetitive negative thought patterns. The worry is that those negative thought patterns pose a threat to the stability of our mental health. And that's why we're here today to talk about that struggle within. That threat causes serious consequences, not just for individuals, but for families and for the society at large. So it's time we begin to talk about these issues freely. We can no longer keep mental health, in the dark corners where they've stayed for so long. We have to start talking about it. We have to break the stigma associated with mental health, the discrimination, so that people can have the freedom, to talk about their mental health difficulties, just like people with physical health problems. Mental health is as important as our physical health. And most of us are familiar with the definition of health, which highlights that it's not really the absence of disease or infirmities. We have to look after our minds the way we look after our bodies, so that we'll have that vitality to pursue our goals and achieve our dreams. Our well-being is a complex physical, mental, and social interaction, and we have to really look after it. The WHO defines mental health as that state of well-being that allows people to realize their abilities, are able to cope with the normal stresses of life, work productively, and contribute to their communities. So you can see from that definition that mental health is actually a part of public health, because everyone is involved. It's not just the individual. An individual's mental health will go into to affect the organizations they work for, the communities they live in, and in turn, affect the economy. Because loss of productivity, when people have poor mental health, loss of productivity will lead to, economic loss. So today I'm going to sort of focus on my presentation today on the origin of where does this struggle with it, where does it originate from, what are the effects, and how do we deal with it? The origin of the struggle within, it's from different perspectives. You can't really pinpoint, this is how it started. It takes different dimensions. There are different aspects to it, and various factors affect, how it develops. Those life events, those experiences like the school, the work pressure, the repeated failures that we encounter, the physical problems, this slide shows, a list of those life events that can actually, result in negative experiences that we found difficult to shake off from our minds. Yeah. And I've also highlighted the societal expectation on us can also cause, for us to have to cause pressure on us. So I think I would want to highlight how the struggle within impact our lives. I would like to use case studies These are true life experiences. These are cases I've been involved with, and the individuals I've learned a lot from them, and I want to share those experiences with you today. One thing we must keep on our eyes on are, one thing we have to keep our eye on is that when the struggle within is persistent and there's no early intervention, it will lead to mental health disorder. So I will start with case study 1, Peter. So Peter is, he is, when I saw him, a 20-year-old university student. Apparently was doing very well until his father became physically unwell. And because his father was physically unwell, it affected the whole family. The finances were not as good as before. So Peter started experiencing financial difficulties, struggling to pay his accommodation, and also to even feeding was a problem. And at the same time, there was pressure with his coursework, exams around the corner. He started to feel, very anxious, very stressed, irritable. He wasn't sleeping well anymore. Then gradually became low and withdrawing from others, from his network, from going to school. And that year, he performed very badly. He failed his exams. So at this time, I just want to pause and sort of ask the audience if they have any questions, relating to that case study I just shared. Hello.
Hello, Ma. For the questions, if you have questions on this particular case study, kindly drop your question in the question box, and at the end of the session, our speaker will be attending to your question.
Yeah, okay, thank you. So let's move on. So if you look at the case of Peter, you find that there was a lot of stress. So stress is, like that weight upon the bridge. That stress is that pressure on our lives. And we just have to find a way of dealing with it. It's unpredictable, it's unavoidable, it's negative. And we shouldn't allow it to define the trajectory of our lives. We all experience setbacks, and setbacks are not proof that we have failed, that we cannot succeed. We should view them as opportunities that will help us to learn and grow. We shouldn't allow stress to progress in such a way that we start experiencing, severe and enduring mental health difficulties. We should learn how to cope with stress. And one way of coping with stress is to recognize those signs and symptoms, which I'm going to highlight. There are 4 main domains when we categorizing the signs and symptoms of stress and anxiety: the cognitive bit, the physical, emotional, and behavioral. So for the cognitive, you find that when you're under stress, you may start feeling very confused. Your thoughts is quite disorganized. You're not as organized as you used to be. People get forgetful. Your concentration would be poor. The judgment, maybe you used to be somebody who would make very good judgment about decisions. You find out that they become very poor and you're making mistakes. There is this constant worrying, and people just describe that their thoughts are always racing and just full of negative thoughts. For emotional, people describe feeling very unhappy, moody, getting irritable and short-tempered, feeling anxious, and they tend to get very impatient, agitated, and getting angry for over silly things or very little things that they wouldn't have even bothered about if they were not under stress. So people would describe feeling very overwhelmed, and there's this sense of loneliness. People have, when people are under stress, they may notice that there are changes in their appetite. It's not just about eating less. Some people actually start eating more. Some people start sleeping too much. Some people sleep too little. One thing that people, especially people who work or go to school, you find out that there's a lot of procrastination. You start neglecting your responsibilities. Going to work, there's poor motivation going to work. You start neglecting your schoolwork. You're not doing your assignments on time. And for people who work, you find out that you're not actually completing the assignments given to you at work as well. And sometimes people pick up bad habits. They start pacing up and down, just biting their nails, just nervous habits that they didn't have before. Some others will start isolating themselves, getting disconnected from people, using alcohol and drugs and cigarettes to start coping with the stress. For the physical, you would notice palpitations, your heart, pounding when you're feeling under stress. I think I've mentioned the changes in appetite. You get easily tired, fatigue, even every little thing you try to do, you just get tired easily. And if you were not under stress, these are things you were able to deal with before so effectively. And they are sometimes changes in your bowel habits. It could either be diarrhea or constipation. Yep. Are you with me? Hello?
Yes, ma, we can hear you loud and clear.
Absolutely.
Okay, that's good. So I'll go on to case study 2. So this is another case I was called upon to, to assess. So this was a 21-year-old university student, and it was, I mean, these are not the real names. I'm just using, for illustration purposes. Sarah was quite bright, outgoing, full of life. She was sociable, but Sarah was always on social media. She would, she was always seeking that external validation, posting pictures, looking for compliment, likes. And when she wasn't getting it the way she hoped, she started getting low in mood. Then she would compare herself to her peers and started to envy them. Some of her close friends appear to be quite popular on the social media. Then she also told me that she had relationship difficulties, and we just noticed that with time she's developed this low self-esteem. And because she developed this low self-esteem, she started isolating herself. Then one day she just woke up and she started shaking and having fits, and they were so vigorous. She showed me the video, where her hands would just be shaking, the whole body shaking, and her parents had to come and take her away from school. And when we did the CT scan was normal. There was no physical health reason why she was having these shakes and the fits. So these shakes and fits were considered to be non-epileptic fits. And anyway, we'll keep questions as answer to the end. Yeah. So Sarah had developed what we call a conversion disorder. if we don't look after our minds and what goes into it, or control how it affects us, we actually could develop a situation called conversion disorder, where stress is converted into very serious physical health problems. And that is why in Sarah's case, her stress was so severe and converted into physical health symptoms like those fits and those shakes. In these, the current trend is that a lot of people spend time on social media, but these habits, and with time, they develop unhelpful habits where they tend to focus so much on seeking validation from people. Their opinions of people, matter so much. Their identity and self-worth is they have to rely on people for that. With time, it's going to bring insecurity and emotional turmoil, and just a roller coaster with a buildup of anxiety and stress that could result in things you never imagined, like we saw in the case of Sarah, where she's having these fits, which we, in the medical terms, are not actually due to epilepsy. So case study 3 is a case of Adam. Adam is a 33-year-old employed, a father of 3 children, described by those who know him, by his family members, as very hardgoing. He was hardworking, was sort of caring towards his 3 children. Then the marriage broke down. And shortly after that, he lost his mother. Adam had a very close relationship with his mother. So I gathered from the people who told me about him. His father had died very young, so his mother had been like a pillar to him. He wasn't particularly close to his siblings. His social network, is questionable, because at this time we couldn't find friends or who could help us in this assessment I was called upon to do. There was significant decline in his social functioning, which resulted in him losing his job, develop financial difficulties, and wasn't able to pay his rent, and the landlord had to evict him. So he became homeless and has been living in his car. And as we speak, he's living in his car. He's become very mute. He's not engaging with anyone. He would, when I went to assess him, he did not speak to me, because I went with a family member who he knows very well. They wanted me to assess him. They wanted us to see how we can get help for him, but he didn't engage with me. But when the ambulance were called upon, I understand he did manage to speak briefly with them, and he just sort of told them, there's nothing wrong with me. I'm homeless and I don't have family. So I perceived Adam to be a very young, to be very angry and upset with his family. I wasn't sure if this was a case of selective mutism, where he has decided to cut off, from his family, or whether this was a case of paranoia. Is this guy paranoid? How do we get him, to be assessed when he's not even engaging with his family? The relationship with the family have severely fractured, and going about this assessment has been very difficult. It does, from what I could gather, it seems he has developed symptoms of depression, and I just wanted to quickly go through the symptoms of depression. Depression is when people go become very low in mood. They lose interest in things that they used to do before. There's social withdrawal. We might also find changes in appetite and difficulties with sleep. The most significant thing about depression is that people start experiencing these feelings of worthlessness, helplessness, and hopelessness. And gradually, the morbid thoughts, gripping, those negative, repetitive thoughts of I'm not worthy, I shouldn't be here, why am I still living? And unfortunately, people start having suicidal thoughts, and there's a risk of actually completing suicide. Just like I highlighted, there could also be a possibility that, his paranoia is because he's paranoid and is beginning to lose touch with reality. These would mean that he's psychotic, and I'm not sure what sort of beliefs that he has in his mind, whether he's developed delusions, whether he's hearing or seeing things. But if those things are present, then that suggests that he has developed a psychotic disorder. And what we usually see in people who are psychotic is thought disorder. They can't really organize their thoughts. They can't process information the way they used to do before. They see everything, as people are against them, and they don't really want to be cooperative with the process that is needed to get them out of those, the difficult situation that they are facing. I just wanted to use this case to highlight that our greatest support system are the people around us. When we disconnect from them, we begin to isolate ourselves. And the danger about isolating yourself is that you are alone, and getting help for you becomes difficult, because even as a professional, I'm struggling, to connect with Adam to get him help. So the people, if he had a very, people around him who could help with this assessment, it would have been very good, for us to get him help. And I also wanted to highlight that families should look after one another. I just remember that when I was told that Adam had told the ambulance people, I have no family, I'm alone. We should be, I don't know how it progressed to this stage, but we should look after one another as friends, as families. We should be kind, we should be caring towards each other, so that when we are in crisis, or people can look after us, or people can sort of help us. And if people are in crisis, we should also be able to extend our support to them. We all should be promoting mental health. Early intervention is key in stopping the progression to developing serious mental illness. We should be part of the healing and the recovery for people. And most importantly, we should not be part of the harm it causes to others by discriminating against them, by, even if you can't help them, then don't discriminate against those difficult challenges that they are facing. So the last case study is Lucy. Lucy, 28-year-old lady, shy and has a anxious personality, employed she had a very good job, but the job was quite demanding. She started experiencing pressure at work, maybe not meeting her targets. I think there was this a colleague at work that she developed a very close relationship with, and this colleague is very sociable and outgoing. So she confided in her the challenges she was having, that she was really struggling in terms of, talking to people, socializing, and she really liked the way our colleague was going about things. Then our friend introduced her to the use of drugs and cocaine to cope with that social anxiety, to cope with the stress. Although initially it did help, according to Lucy, but we found out that in the longer term, she's developed a drug addiction, which led to her losing her job. Then she lost her income, and this just resulted in further decline in social functioning. And this was a person who was very high functioning, but because of the maladaptive way she dealt with the challenges she was facing, the negative consequences even became more challenging for her. Sometimes people say, they start to use drugs like cocaine, cannabis, or amphetamines as a form of recreation. And others will say it helps them cope with stress and anxiety. But the bottom line is that those substances, that whether we're using it for recreation or whether you're using it for to cope with a difficult situation, the effect and the impact on the brain is what we are concerned about. We find out that those drugs can cause a chemical imbalance in the brain, and that will lead to people having serious mental health difficulties. Sometimes people will tell me that, oh, my friend uses it. How come nothing happens to them? And they don't actually believe that their problem stems from, the drug they are misusing. But what I want to highlight is that the vulnerability to risk is not distributed equally across individuals or groups. Everyone's brain is unique. We shouldn't say because it is not affecting another person, then it is not affecting us. It doesn't work out that way. When there's a chemical imbalance in the brain, it would lead to people developing anxiety disorder, depression, psychosis, and drug dependence, or even people abuse alcohol. So addiction actually, from misuse to addiction now, it started with use, misuse, now addiction. So addiction is a condition that, has caused long-lasting brain changes. People find out that they are able to cope for a bit, stay away from the substances they're using, and after some time they relapse. And this just keeps going on and off, on and off. And despite knowing the harmful consequences, there's just this compulsive seeking for that drug or substance, and they can't just help it. There's this constant seeking for it. Yeah. Should we pause and take questions, or should we carry on to the end?
Let's carry on to the end, Ma.
Okay, yeah, that's fine.
We'll pause after.
Okay. So how do we deal with the struggle within? The first thing to do is to develop that self-awareness. That internal dialogue that is going on within you. What are your thoughts? What are those thought patterns? that diminish you instead of empower, to empower you to do things that you want to do. So you have to sort of develop awareness. They creep in quietly, and knowing what they are when the triggers, it's quite important. And also for the people around us, even though they don't tell you, you might begin to notice their behavior, noticing their behavior that things have changed. And if anyone is experiencing any of these difficulties and the struggle, and they're really struggling within, if you're not able to help yourself or others, then they should be signposted, to the right channels or the right organizations that can help him, that can help them. It could be, I think later on we might hear resources that would be available for students, in University of Lagos. We do want people to know that there is hope. And the key is early intervention, and treatment is available at whatever stage you find that you're struggling within. Although delay in treatment causes serious consequences and a poor outcome, but having treatment can also lead to recovery and help that would also prevent, further decline in functioning. So I've just listed some of the coping strategies that people need to develop when they are really stressed and anxious. Try to avoid using drugs and alcohol. Don't rely on substances, because if you keep relying on them with time, there is a dependence on them, and it will lead to more problems. Exercise, eat well, sleep, develop a very good sleep hygiene. Make sure you have things. I think the recommendation is at least 6 hours sleep. Participate in social activities that are inspiring, and where you are able, that motivates you. Develop a support network that are quite positive, and not people that discourage you or try to put you down. And for your internal, for you to help yourself, you need to develop that positive thinking. You need to help yourself. And if you find that you're struggling to help yourself, like I said, you can talk to professionals that can offer talking therapy. The interventions that that are available, apart from you trying to do things yourself, medications are available. There are psychological interventions in form of therapies. We have different types of therapies, and there's supportive therapy. There's also more intensive therapy. It just depends on what the assessment shows us and what we believe will be best for the person. We will actually tailor a treatment according to the assessment of their needs. Psychological interventions would look into depth, those negative thought patterns, that is causing that struggle within, the behaviors, and also the social stressors that we are really finding difficult to cope with. I think what people need to recognize is those negative patterns are embedded in our subconscious. It's not something you can easily notice. But people should know that this is not reality. Those negative thought patterns are perception that sort of sabotage your progress, your growth. And you should start to challenge those thoughts once you recognize them. the journey to challenge those negative thought patterns is not a one-time event, because it's not something you just do one day and think is all over. It needs conscious effort. It needs maybe help of a professional, and it is a journey. But the good thing is that we do have successful outcomes. Our behaviors, most times they mirror what with our thoughts. When you're thinking, I'm not good, I'm not worthy, you find out that I don't fit in. You start withdrawing from people, you start disconnecting from people. So our behaviors actually, regarding our behaviors, we start acting in ways that actually align with our beliefs. And like I mentioned before, this is all distorted reality that we should, actively challenge. Apart from medical solutions, there is research that is evolving, that how spirituality can actually help people to deal with crisis, mental health crisis, and vice versa. How if you're a spiritual person, it might also help you against developing a crisis and the serious consequences of mental health problems. Especially spirituality is especially recognized in addiction medicine, where people have to break that drug habit, and it's not just medications is not going to do this job for you. It's something that you have to have the motivation, you have to develop a formula to challenge it and break the habit. There are different types of spiritual faith. People, there are Muslims, there are people who there are different research going on. But for the Christian faith, the research shows that when people have an addiction, they need to admit that there's a problem. They need to have this brokenness, true repentance that I can't do this anymore. And if there's genuine repentance and you consecrate yourself to doing good things and trying to stay away from, the things that sort of push you into using drugs, focus more on your purpose, your values. These actually help. So the take-home message today is that mental health remains a challenge all over the world. But it is our duty to protect our brains against the struggle within. And we should allow our brains to achieve its full potential. And another thing is, I want people to take away today is to dispel the misconceptions that we should be hiding mental health difficulties. It will be seen as a form of weakness. There is no hope. It can be treated. Neither can it be prevented. These are all misconceptions. Thank you.
Thank you so much, Ma. This was such a beautiful and enlightening session. I believe I can be heard.
Yes.
Yeah. I just want to say thank you once again for a very beautiful and enlightening session. I was able to follow through. My jotter is almost full on the page.
Thank you.
Just want to say thank you once again. These are the kind of things you pay for, and we are just getting it like on a platter to just help us. While you were speaking, our very wonderful VC came in. I would like to appreciate her presence. If you would allow that, I would like to welcome Professor Folashade Ogushola, our wonderful Vice Chancellor of the University of Lagos, and a patron of the KB Klub. You are most welcome, ma. Thanks for being with us. Thanks for coming here. And we would like you could say some words to us. Hello, ma, you're muted if you're speaking. Yeah, yes, ma, it's not really audible. The sound is not really. Hold on. Yes, okay. Yeah, I think it's much better now.
Okay, is this better?
Yes, ma'am, much better. Thank you very much, ma'am.
Okay. I said I am actually on a plane, so it's a bit noisy on my way back. So I said I had to join just to encourage all of us. And I want to thank the guest speaker for doing an excellent job. Thank you very much, because this is an area that we really need to, talk about because of the stigma around it. And at a time in Nigeria where there's so much stress for young people, and for many of the students, it also means that many of them are struggling to pay their fees, and fees are going to go up. The cost of living has gone up. And for many people, it is a struggle. So I want to use this opportunity for people to take away from this lecture. One, don't neglect the support systems. Talk to your friends. Also use the university support systems. And for those who also have challenges paying fees, remove the areas of stress, latch on to things that have been put in place. So those who have problems with paying their fees that is adding to their anxiety, please use the NEL fund. Take that loan. It is a soft loan, and it will take one major stressor off you so that you can have your education. For those who are scared and so on, reach out to your friends and use the counseling services that we have. But all in all, I want to thank you for those who have joined, and for everybody. If you see anybody who is withdrawn, please reach out a helping hand. Let's reach out to each other. Let's find out what our friends are doing. People who are suddenly changing their behavior, let's also talk to authority that somebody might have a problem. Let's remove the issue of it's not my business. When we are our brother's keepers, then many of us will have the support system, because sometimes we don't even know how to ask for help, and it is the rest of us that must come in and help. So thank you very much for allowing me to speak, and I hope you could hear me because I'm in a pretty noisy place, but I'm glad to have been here, and I'll soon be off again. Thank you.
No, thank you very much, ma.
And congratulations, KB Klub.
Thank you so much, ma. KB. We want to appreciate your presence here with us, and we're very much delighted at the words you were able to give us. Most importantly, having a support system, as you wonderfully pointed out, and we'll make sure we continue to talk about that. We continue to imbibe that ourselves, and as you had mentioned, be our brother's keeper, essentially. I would like to ask if Mustafa Madin would like to say anything to that before we go to our question and answer session. I think probably he has network issues. Now we'd like to proceed to hello, are you here?
Yeah, I'm available. Thank you very much, Tobiloba. I want to say a very big thank you to Professor Folashade Ogushola, our mother, Vice Chancellor, University of Lagos, and the patron of the KB Klub. I am very, very grateful. Also to our guest speaker, Dr. Uwaila Olotu for giving us your time on this session. As said, there are many resources available for us as students, and we're very grateful for giving us this opportunity. And we're looking forward to the question and answer session on this call, on this webinar. Thank you very much.
Thank you.
Yes, thank you very much, Mustafa, the key bites of the KB Club. Now I'll be proceeding to the question and answer session, and I believe our guest speaker is more than ready to answer all of our questions. I would like to throw the floor open to our participants. If anyone has a question, would like a raise of hand, or if you prefer to drop it in the chat box. It's also important to note that before this webinar, we threw a Google form out to people to be able to ask their questions. For those that might not want to ask, or might feel shy, or their friends are listening in on the session also. So they were able to send in the anonymous questions, and we'll be taking that also. The first question I have here, probably not as explanatory, but this individual was asking how to deal with anxiety before an exam, even though you are well prepared, because it could sort of affect your well-being as a person. You've read, you've prepared, but you are still very anxious and you feel like you're going to fail. How do you get yourself up? How do you psych yourself up? How do you get better in a short space of time? Now, would you like to answer that first?
Yeah, I think I've sort of touched on this during my presentation, that how to cope with stress and anxiety. Recognizing those that you're under stress, recognizing that you need to start dealing with it on time. Start with the positive thinking, challenging those negative thoughts would help. Hello? Can you hear me?
Loud and clear, ma.
Oh, okay. Yeah, does that sort of answer the question?
Yes, it does, ma'am.
Okay.
I would like to ask another question.
Yeah.
And this is very important to me. How can one effectively manage failure, lost opportunities after working so hard?
I mean, setbacks, we shouldn't see setbacks as, it means we will not be able to succeed again. Setbacks shouldn't be the lens through which we are viewing our future. We should know that everybody, at some point in our lives, we will encounter setbacks, but it's how we take it. Is when we know that they should be building blocks to progression rather than this is our future. You can succeed again even after having setbacks. You should try and develop, ways of renewing your strength, focus on things that you're good at. And you might also develop a strategy to improve on things you need to do to grow and learn. Yeah, because if you don't do that, you'll be caught up in this negative, cycle, thinking that is it now. I just have to give up. If you look at the stories of, a lot of successful people, that they, at one point in time, they had setbacks, but they did not give up. They just kept trying and trying and trying. And we should, also try and do that to overcome challenges and setbacks.
All right, thank you very much for your response. Oh, Sally, please hold on. Thank you very much, Ma, for your response. Right about now, I would like to introduce the person of, and welcome the person of Mr. Olusegun Akinagbe, a representative of the Director of Student Affairs. And if you would like to say a few words to us before we proceed.
Good afternoon, all. It's a pleasure coming on board. The director is unavoidably absent. It's an official assignment. So he has appointed me to represent him. Well, first and foremost, I would like to thank the guest speaker, Dr. Uwaila Olotu. I hope I pronounced the last name correctly. Pardon me if I did not. Thank you for that very fine lecture. The case studies are well chosen and very illustrative. One thing that we need to know is that the issue of mental health is something that is very important. It's something that we cannot wish away. And many people suffer in silence. From time to time, we are confronted with one mental health issue or the other. So, and most people, like I said, suffer in silence. But there is one key thing that the lecturer emphasized, is that we need to be our brother's keeper. So it means that we want to try our best to check up on one another. We want to be good listeners, and we don't want to draw insinuations. When somebody says, I'm pressed, time again, people make negative statements when people tell them one thing or the other. So when such a thing happens, the person may be bound to withdraw. So, and that may have a negative consequence. But rather, I want to pay attention to the person, I want to listen empathetically and help the person seek help, as it was mentioned in that talk. Well, at the university level, our students who go through mental stress a lot, and there are lifelines that they need to explore. At the College of Medicine, University of Lagos, we have the counseling center, which is available even 24 hours. So you can take of that. And the good thing is that the management has taken it a step further by bringing counseling to the doorstep of the students. Not that if they need one help or the other, they don't have to go outside of the hostel to seek help. So that is in the pipeline. The management is working on that. So once again, I want to opportunity to for bringing so that it's a negative outcome, like suicide. Thank you very much.
Thank you very much, Mr. Akinagbe. I just want to ask a follow-up question to what you said. Sorry for keeping you. I would like to ask about resources available in the College of Medicine specifically, aside the counseling unit you mentioned. Are there any other resources you put together? Are there support groups? What resources are available for students, specifically in the College of Medicine? that we can utilize?
Thank you very much. It is not everything that depression does not. When some students are going through some challenges, it's not everything that results in depression immediately. For instance, anxiety over finances. Skin. If you just take advantage of that, somebody does not have very difficult to disturb this. So, students who are part of the message that we just such ones have been taken. We have we also have counselors too, like psychologists, who such experts for proper management.
All right, thank you so much, sir. Dr. Uwaila.
Yes, I'm here.
Yes, there's a question in the chat box. I'm wondering if you could that's it.
Okay.
Or should I read it out?
Please, please.
Yes, so this is quite long. So the person says, for about 2 months now, just before exams, I've been feeling demotivated, less energetic and sad. It got to the peak around last week, and I reached out to a lot of my friends, and I've not gotten fulfilled yet. I've been an academic enthusiast, encouraging a lot of my juniors, but finding myself less visionary regarding academics. I've been having serious insomnia, divided attention, and forgetfulness, confusion also. I get to work, and I seem not to understand what is going on around me. I sincerely need help. Everything seems unpromising, and I don't like myself at the moment. I'll be glad if I could get some help.
Okay. Thank you for sharing that, because it's not easy, to share those difficulties when people are experiencing what you've just told us about. I think the first thing is that by the time you're seeking help, it shows, to me, that you might have tried, in some ways to help yourself, and those strategies are no longer working. So at this point in time, you need a professional to do an assessment for you. An assessment to sort of do a formulation as to what are the triggers and look at how you can be helped in other ways to cope with the difficulties you are facing. So having an assessment doesn't necessarily mean you will get a diagnosis. I think this is where people get it wrong. Having an assessment is just somebody to sort of organize and tell you these are the problems you are facing, and sort of have a treatment plan for you. Even the treatment plan might not necessarily mean you have to take medication. So, so the first thing is for you to have an assessment. It might just be, and this is an emotional psychological treatment, and counseling would help. But if we don't do an assessment where we tease out why you're having these difficulties, it becomes a very recurrent pattern. Like I mentioned before, some of these negative thought patterns, they are in our subconscious, and it's not something we can easily identify or recognize ourselves. So I think at this point in time, there need to be an assessment of what the difficulties are by a professional and help you formulate a plan that will help you.
All right, beautiful. Thank you very much, Ma. Yeah, I also have one question here. We know we are young people, we are students. This person is asking about addiction and how it can it be managed medically. So I'm guessing the person is struggling with putting an end to it. So the person wants to know if there could be a medical solution to addiction.
I think I touched on this in my presentation, that there's no, even if maybe early intervention was mixed, that doesn't mean that no help is not available. So even it's just that it's better when there's early intervention so that it doesn't progress. But once there is an addiction, there are still ways, to deal with it. So there are behavioral therapies, there are psychological interventions that can be used, to help the person to break the addiction. Addiction is a habit, is a habit the person has developed. And it also needs professionals. You need to work with professionals. It's not something, sometimes people have the motivation to deal with addiction by themselves, but it's very difficult that you be able to get out of this situation by yourself. So it might be you need the help of a professional just to guide you, to give you the tools to use to break out of that addiction.
All right, thank you very much, Ma. I just go on same thing. We are medical students, and for me, I like to describe medicine as a course where you are learning to save lives, but it's like you're giving your own life in the process. So there is someone here asking about suicidal ideation. So he doesn't feel there is any thing to live for, and the only thing holding him or her back from actualizing this plan is not breaking the parents' heart. So how do we attend to such persons? And the person is not also willing to speak to friends. So there's no way they can also come through. So how do we attend to this kind of individual and help them get out of that space?
Yeah. So when there are different reasons why people develop suicidal ideations. It doesn't really mean that people are depressed. People might find themselves, in a very difficult situation, and they made that choice, that when the thoughts start coming and they go on to complete suicide. But the most important thing is when you start having such morbid thoughts, you need to challenge them, as to there is nothing you're experiencing now that nobody, if you find out or you ask people, you find out that even people have experienced even more adverse, sorts of problems. And don't feel that, what I'm experiencing is me alone, and I must end it all. There is always a solution. There's always a way out for people. So we shouldn't think that this the situation we find ourselves is a hopeless one. The key factor that is responsible for people going on to complete suicide is hopelessness. So we need to break, people developing getting to that stage. We have to instill hope. We have to know there is a way out. They need to know there's a way out. And you find out that in most cases, they've not even tried, to break out. They've not sought professional help regarding what they are facing, right? They've not tried to explore the various ways that they can get out of this situation. They are embedded in that negative thought pattern. They are struggling themselves, struggling within, and there is now the distorted reality. What you are facing is a perception, is your perception. you know, and you need people to challenge those perceptions for you, that this is not you, this is not real. You are equipped, to be able to overcome adversities, and that is what you should do.
All right, thank you very much for your response, Ma. I really appreciate, and we believe that must have gotten help by these responses, and now we know better and to act better. Sally, please, you can go ahead.
All right, thank you so much, Ma. Thank you for your answers to all the questions, Ma. Moving on, we have a question from someone. They are asking, okay, how can one help a close relative who has gone through schizophrenia, Ma?
There are different ways of helping people with schizophrenia. One is to make sure they get the right help. Another thing is to make sure they are receiving the right treatment. And we find that sometimes people think that because people have schizophrenia, they are not able, they've got a diagnosis of schizophrenia, they are not able to function. That's not true. With the right support, you will find that a lot of people with diagnosis of schizophrenia, they are functioning, they are doing managing jobs within their capabilities, and it just needs people to support them in the right direction. So for somebody who wants to help them, you might want to navigate those support systems that will help the person. It might be that you need to find out what is available, what help is available, and how you can assess that help for the person. That would be my advice.
All right, thank you so much, ma'am. I believe that if this person is listening on right now, they will be getting the best and accurate information right now. Another question. This question says, I need to get away from my childhood trauma. What causes me to always relate or remember my past? And anytime, whenever that happens, I get so angry. Did you get that, ma'am?
Yeah, I did. Childhood experiencing. Those childhood experiences needs to be challenged. Because you've had childhood experiences doesn't mean they should stop you from doing things in life. You need to question, why am I allowing those childhood experiences to shape my future, right? You need to let go of those childhood experiences. You need to look at sometimes it's difficult. What those childhood experiences are, I don't know. But if you sit with somebody who would sort of tell you that this is in your past, right? And sort of find out what were the difficulties in those experiences that seem to be affecting you now, and find a way of how you can overcome them. You can overcome any type of experience, any type, whether they were in childhood, whether they are in adulthood, even traumatic experiences. It's just, finding the formula to use to overcome those experiences. If you're not able to do it by yourself, professionals should be able to help.
All right, thank you so much, man. Thank you so much, man. I think I'll have to pass the mic over to the host. I believe he has more to say on this. Yes, ma'am.
All right, thank you for having me. It's been quite refreshing.
Yes, Ma, thank you very much for your responses so far. I'm sure we've been able to pick one or two things from it. I know you touched on this while you were speaking, but this question says, how do we know in specifics when we are depressed? So if you wouldn't mind going over it again.
Yeah. So when the first thing you might notice if you're getting depressed is your mood is low, you feeling sad, you know, and it becomes sort of, it starts slowly, but with time becomes more persistent. Then you find out that during the periods of low mood, you lose interest in those things that you used to enjoy doing. Maybe all the hobbies you used to do, you stop doing them. Then you notice that these negative thoughts, you know, starts to creep in. People will tend to focus on the negatives and overlook the positive. So when people are low in mood, is all those negatives that tends to be prominent in their thoughts. They tend to focus so much on the negatives, and with time, they begin to feel hopeless, worthless, and helpless. They disconnect because they're focusing so much on the negatives. You find that they withdraw from people. Maybe if people were critical at one point in time, they become so overly sensitive to other people's comments, and they would remember all the negative comments maybe people have made before in the past. Even if people have tried to, you know, be nice to them in the past before, but you find out that they are dwelling more on the negative experiences that they have with people. So with time, they would socially withdraw. They isolate themselves from people. Then there's this disconnection from people. And when you are alone, when you're alone, maybe with time, they don't have motivation to do things anymore. They are not sleeping well. They are not eating well. Everything becomes, you know, the problems are just piling up. And before you know it, people start thinking, why am I alive? What am I doing here? You know, and try, you know, at the very early stages where you start noticing, you know, you're feeling low, to, if you know you can't do it yourself, like I said, medication is available. If people develop antidepressants, depression, there are antidepressant, there are tablets that can help you to get out of depression. 6 out of 10 people, you know, respond very well to antidepressants, and they are able to function very well at work. We've got a lot of high functioning professionals who take medication. We've got managers, we've got, you know, top people, officials, you know, even though they are taking their antidepressants, they do get well. And one thing people need to understand is that it doesn't mean you're going to feel depressed or take those medications for life. It might just be, it's, you know, it's a period. So you find that some people take medication for 6 months, and after that they don't take it again for the rest of their lives. Some people take it for a year, and after that they don't take it again. So because you're an antidepressant doesn't mean, oh, you're going to take it forever. It's when you don't even take care and allow your brain to recover, and the assault and the chemical imbalance just continues and is persistent, then you're doing more damage.
All right, Ma, I think we now have a clearer perspective and clearer view of this, and I believe the person has gotten appropriate answers to the question. In the Q&A chat box, I can see a question which I would personally want answered. This is by, I think I'm allowed to call the name, by Shalom Jonah. It says, a fellow medical student once shared with me that he has this dissociative identity disorder. I'm wondering how he got to know that. Please, is such condition inborn or physiological? And what help can I offer as a friend?
I think from looking at that, it's just self-diagnosis. I don't understand what the person means by dissociative disorder. You know, it's more complicated than that. Although Google, a lot of people just look at Google I have a lot of people coming to my clinics, the hospital, telling me I've got this disorder, I've got this, I've got this. Well, it's not true. You know, just because people really have the, you know, they've Googled some of those symptoms, they don't really understand it in a way that before you make such diagnosis, you know, there needs to be a thorough assessment. And they have to meet the ICD criteria for diagnosing mental health disorders. They're usually threshold or just one symptom or just one fixture of the way you present it doesn't give you a diagnosis. Sometimes you need to have additional symptoms, you know, before you get it. So I am not entirely sure, because that disorder is very rare. I'm not entirely sure that that person actually have such a disorder.
All right, Sally, I think you have something to ask.
All right, Ma. Thank you so much, Ma. Thank you for everything so far. We just have one more question to sort of wrap up the Q&A session. Ma, the question is, now we talked a lot about, you know, disconnection. We talked a lot about access. We are in College of Medicine, and we want to know how, I mean, what is very important is how these tools, these resources can be closer to us. That can maybe motivate people to reach out. So we want to know, how can PANI, you know, be closer to the students? How can students access PANI? How can PANI become a very, very familiar name in the College of Medicine, such that people will have access and be able to go to at the end of the day, ma'am?
Okay, thank you very much. I think the first thing we have to do is to maybe sort of identify within the student population people that can act as mental health champions. Because sometimes it's not good for everybody to just be coming. You know, we need to have representatives on ground, and these people can act as mental health champions. So those people can be trained in, you know, just sort of knowing how to recognize who is struggling, the basic signs and symptoms, so that those champions on ground can refer for detailed assessment, to PANI. Then we conduct our assessment and formulate a treatment plan or management plan for the person.
All right, Ma. Thank you so much, Ma. I think my question has been answered properly, Ma. Thank you, Ma.
You're welcome.
Yes, Ma. We are gradually coming to the end of this session. It's been an informative one so far, but we would like you to speak about PANI. If there's anything you want us to know, if you have anything coming up, for the students in the College of Medicine, for anyone listening, for people streaming on YouTube that would like to know more about PANI, we would like you to speak to us shortly about PANI.
Yeah, I think people can join us on Instagram, you know, where they can follow what we're doing. And we also have a link where people can ask questions on our website. We've also have assessment forms online that people can fill directly, which comes directly to specialists working for PANI. So there are a lot of, I think people are not really aware that help is available. So if you can spread that news within the student population, you know, how that PANI is a charity organization that really wants to help people to overcome the barriers that they have in having that support for their mental health challenges and difficulties. I do recognize that in Nigeria, there are lack of resources available. A lot of people are gaining the awareness now that you know, I'm struggling, but interventions are not available to them. So And even if interventions that are available, people might be very remote or maybe hospital based, and people also do not want to go to places where they are easily seen or where they are easily discriminated against. So there is always online services as well. You can start from there, just to sort of find that help, even sort of somebody to validate what those experiences you are going through and know that you're not alone. So PAN is there.
Yes, it's beautiful to know that there's PAN willing to listen to us, there's PAN willing to help us. And we appreciate your wonderful work with PAN. As you said, a charity organization that wants to help provide access to people on mental health issues, provide mental health support. And we appreciate that a lot. And I would also be taking it upon myself, and I'm sure other key bites and other people on here would preach the gospel of PAN to people in the College of Medicine and beyond. Once again, thank you very much for your responses, Ma. We appreciate. Right about now, I would want to bring on Covenant Igbula to give a vote of thanks and to speak on what is next for the KB Club.
Thank you very much, Ibagadibayo. It's been quite a very insightful session. I have learned a lot from this session. I would like to thank Dr. Uwaila Olotu for taking her time to ensure that she has been able to equip us with the right kind of knowledge that we need, basically. I would like to speak on what's next for the KB Club. So over the past months, since the start of September, we have been campaigning on mental health, prostate cancer. This is supposed to serve as a pre-intervention phase of our major philanthropic events, the 55th annual philanthropic event of the KB Club. That is themed Even Heroes Need Saving. And this intervention is targeted at reducing mortality that arises from prostate cancer as well as mental health. So we intend to carry out a free prostate cancer screening as well as mental health assessment and general medical screening for the men of the military at Mada Barracks. And this is scheduled for the 12th of October, next week, Saturday. So this event is packaged for strictly for the military. However, the pre-intervention phase, we have ensured that every member of the public and our surrounding communities benefit from. And this webinar is supposed to be the closing part of the pre-intervention phase. So I want to thank each one of us for coming on this call, on this webinar, and sharing insights with us. Also, on the 30th of November, we will be hosting the staff reform at the University of Lagos. Staff reform is a health tech conference that seeks to bring policymakers in healthcare institutions, medical students, well-wishers of the nation that seek to see how we can progress healthcare utilizing technology available to us. The theme for this year is Fast Forward, trying to see how we can ride on the back of the success of staff reform from the previous year, which was a huge success. So this year, we will be looking at that, and we want you to mark your calendars November the 30th. I want you to be a part of this event as well. So I want to thank everyone once again. I want to thank the Vice Chancellor of the University of Lagos, Professor Ogushola Folashade, also our patron. We really appreciate your presence here, Mark. We want to thank Dr. Uwaila Olotu. We would like to thank the Office Director of Business Affairs, the DSA, the representative, Mr. Olusegun Akinagbe. Thanks for coming on this call. We want to thank the Communications Unit of the University of Lagos, Mrs. Alaga. We want to also appreciate Mrs. Nike as well, the Communications Unit. We'd also like to extend our appreciation to Mr. Adiwale Fatai of CITS for his support as well to the success of this program. I'd also thank our students and everyone that has taken their time to be a part of this particular webinar. Thank you very much. And we look forward to your participation in forthcoming events as well. Thank you very much, and have a great day. I'll hand over to Adebayo now. Thank you.
Yes, thank you very much, Covenant. Thank you very much, our guest speaker, and Dr. Uwaila Olotu. Thank you very much to everyone that has stayed this long to attend and participate and also learn. I just want to ask before I close this, would the keybites want to give any remarks to close off this session?
Hello, good afternoon. Just want to say a very big thank you to everyone. The KB Covenant with Uwaila has been able to touch on what we have planned for the rest of the year. Look forward to all of the resources available by the University of Lagos as well as the College of Medicine being better publicized and made known to every student of the College of Medicine and also every student of the University of Lagos. We at the KB Club will continue our work of championing philanthropy, academic excellence, and social empowerment, working very, very closely with close collaborations from everybody interested, because we believe strongly in the power of collaboration. We are grateful once again to Dr. Uwaila Olotu for your very, very in-depth and beautiful delivery of this topic. We thank once again the Vice Chancellor, University of Lagos, Professor Folashade Ogunshola. I also appreciate strongly Mr. Olabode Akinwumi. Appreciate Unilag Communications for always being available to ensure that the students of the University of Lagos come first, as always, as the University of Lagos is also first choice. So thank you very much. We look forward to you being a part of our activities going forward. Thank you very much, Adebayo.
Yes, thank you very much, my keybites. Thank you very much for everyone that has participated so far. You can follow us on all platforms. It's KB Klub CMUL on all platforms. KLUB, KB Klub, KLUB, KB Klub on all platforms. You can sponsor our events. Please send a mail to kbklubcmul@gmail.com. To follow us on socials, once again, it's KBKLUB, KB Klub on all platforms. Thank you very much for staying with us this long. See you on the 12th of October and see you on the 30th of November at Stack Reform Conference. Thank you very much.
Thank you. Bye.
Thank you very much, Mel. Thank you very much, Mr. Sunday, Mr. Kiangbe. Thank you very much.
Thank you.